Okay, I think I've seen a decline in folks joining the call, so we'll go ahead and get started. Welcome again. I am Nicole Yo-Fisher. I am the Clinical Education Manager here at HealthInfoNet. And I'm also being joined by Chad McLeod, our Director of Product and Communications. He is going to be sort of in the background today, manning the chat for me. So he'll jump on, and if anybody has any questions throughout the webinar, certainly feel free to use the chat to put those in there. And then throughout the presentation today, we'll answer those questions and save time at the end as well. What I would like to do for today, I have a PowerPoint here. I have some things that I want to show folks on our website. Essentially, this is our communications package update. There have been some few changes in functionality to some of this information that we have for folks. Overall, though, the premise and the foundation of what patient education is for HealthInfoNet has not changed. We've just made a few enhancements that we want to share with you all. I popped on just so you could see my face real quickly. I may take my video offline here for just a second, and we'll get into the PowerPoint. Okay, so today the objectives for the webinar are educating you on our connections and services for HealthInfoNet as the Maine's HIE, or Health Information Exchange. Just a little bit of overview if there are any new folks on the call, just to talk a little bit about us at HealthInfoNet. Obviously, the large chunk of today is going to be reviewing the components of our communication package, and then we're going to provide you some information on our education and training opportunities that we offer here at HealthInfoNet. So what is HealthInfoNet? We are, as I said, the state's Health Information Exchange, or HIE. There are laws that govern what we do at HealthInfoNet, and we'll get sort of into that here in a little bit when we go through some of the components of the communication package. But we do have a law that governs our general medical information, and we also have laws that govern actually mental health data that we also have available within the exchange. We are independent and nonprofit. We have a community-based board of directors. We have board members throughout many facets throughout the state, including medical providers, public health organizations, patients, government agencies, and businesses throughout the state. We provide a number of services to our participating organizations, which most of you know is what we refer to as the clinical portal. But we also have within the clinical portal real-time event notifications. We do a lot of public health reporting, and we do have a predictive analytics tool that we do use as well here at HealthInfoNet, and that our participants use. Our vision. So we are committed to delivering trusted health information exchange services to the communities to create lasting system-wide improvements that improve patient care. We do this to create better, easier, and safer solutions. And through the application of timely and actionable information, we adapt and advance clinical workflows and operational needs across the care continuum. Connections. So this is always sort of a nice little graphic. I tend to be a little bit more visual. It's kind of neat to see all the different areas of folks that are connected to us and sharing data with us. We do have a large amount of information coming from federally qualified healthcare centers. We are connected to all of the state's health systems. We get medication data through SureScripts, as well as Maine Care pharmacy data. We have connections with different laboratories throughout the state. We also have, as I mentioned, some mental health data, which includes some community-based mental health providers. We have post-acute care connections. Most recently, we have EMS data, but we've also added some users that include impact, so getting the impact data. And right now we did create some connections with Riverview and Dorothea Dix. They are still what we call view only, so they're not sharing data into the exchange currently. Hopefully that will change in the near future. We also recently added PMP data as well, so folks are able to access the PMP through the exchange. As that sort of, as we talk about PMP data being available, we are also going to start to connect to the eHealth exchange. We are starting with the VA, so that will be news to be shared with folks. Hopefully around the end of March, we will be letting all of our users know. We're going to be pulling together a lot of different communications around that, but we previously had a connection to the VA that did get disconnected due to a change in EHR systems through the VA, and then the pandemic happened. But we're very excited to be getting that data soon, as well as Indian Health Services data. And as I said, we'll definitely be sending out some communication around that, and a big push to our users to know how to access that data here very soon. This is a snapshot of the various different types of data points that users can access in the clinical portal. And now let's get to the heart of the matter here. So the communications package. So for folks that don't know, when new organizations onboard with us, as well as our currently established participants, all of those folks, whether or not they are sharing data, all have to go through what we refer to as our consent process. Part of that patient consent process is also sharing with you what we refer to here as a communication package. So the purpose of having this communication package is to let folks know, provide them with an overview of our legal requirements and the various necessary resources in implementing not only the consent process with patients, but it also is more encompassing to include letting your patients know, letting your staff know, having the legal resources, having some communication resources, whether it's different various posters, depending upon the patient population that you're working with. But it's really an overall package that should meet everybody's needs, depending upon if you're working in various healthcare areas. So this, I should go back here. So this overview, this is what's included, this page that you see here. So it's letting you know all of the different resources and forms that are available within the package. As you will see, there are 2 required components. So that's getting more into those, that patient education and the opt-out form, which we will get to. But this is really just giving you that overview. The first required form, and I should say required forms, is the opt-out. So as HealthInfoNet is an opt-out program, which means every data is included in the exchange until they choose to opt out. This is the opt-out form here. There is a corresponding, what we refer to as the overview poster. And so typically what we recommend folks do, if you're printing this out on paper, it's you can easily make this a 1-pager, have it go back to back. But this is the required form that all of our participants are required to give to their patients one time only when they start participating with us, and on an ongoing basis for any new patients that walk through their door. It's just notifying them that you are a participant with us, and that a patient does have the right to opt out by completing the form. So we're going to break down this communications package just a little bit more, starting with staff education and training resources. So what we like to do is provide you with a lot, like I said, a lot of different information, and it's really up to you to determine sort of what makes sense to you, what's applicable to you or not. So starting with the overview of HealthInfoNet. So part of this communications package is a PowerPoint. You will see this PowerPoint when you go through a consent training with us. So this is something that happens via a webinar discussion training, or this PowerPoint is also available in our HealthInfoNet Academy, which is our online web-based program, which we'll get to as well. But this is really for any and all folks who need to be doing that patient consent process. It's going over what we are at HealthInfoNet. It's exactly what you all are walking through with me today. Really, the audience and the use case for this is internal staff. So it's those folks that are going to be doing patient education. Oftentimes, we get asked, who are the right folks to be doing that? It's obviously going to be different for each organization. Typically, it's those folks that are, if you are already established with us at HealthInfoNet, and you're doing this workflow already for new patients that walk through your door, it's those folks that are a part of that process. So who's doing an intake? Who's having sort of that first touch with your patients as you're going through any of your own, paperwork, intake process with onboarding them to your organization? It's very easy to have that our opt-out form be a part of that intake process and to have those discussions with folks. So typically, like I said, it's your front office staff, it's intake coordinators, it's those people that are having that sort of first touch with your patients or clients at your organization. The next piece of information that we have within the communications package is the participant internal staff communication template. So this is something that the audience for this is also really your internal staff. It's letting folks know if you're new to joining us, it's letting them know that you now connect to us at HealthInfoNet, talking about the value of the services to any of those folks that are going to be given user accounts and be accessing the information within the exchange. And it's also sharing what our educational resources and training opportunities are at HealthInfoNet within your own staff. This also just highlights some language, which you can obviously, insert any information that you want to within this internal communication. Like I said, this is something that may not necessarily be needed if you're a smaller organization, if you're having some of those conversations within staff meetings or any other staff communications that you're already having. But this is really just to help you use some language when talking about HealthInfoNet to your staff. Registration staff script template. This can be really helpful for folks, even if you're already established with us at HealthInfoNet, you've already been doing patient education with the opt-out form. But let's say you have new staff that come on. And so it may be a little bit nerve-wracking at first to talk about HealthInfoNet if you're not familiar with us. So really what this does is it helps to sort of talk about some different questions that folks may have, how to answer them, clearly be able to clearly articulate what a patient's consent choices are, be able to discuss the benefits, what is HealthInfoNet, all of those sort of things. What I will say, and what I always emphasize in my training, I want folks to really hear this, is that we don't certainly expect you all to be experts in what we do at HealthInfoNet. So if you have patient questions that are just really difficult to answer, you're not sure how to answer, please feel free to send them back to us here at HealthInfoNet. One of the things that I also highlight and stress that I feel is very important for folks is that we're very transparent about what we do at HealthInfoNet. It's not meant to be a secret. It's not meant to be kept from patients. It's not some secret place that you log into that's available for anybody to find on the internet. It's highly protected. It's HIPAA compliant. We really take this information very seriously. And so we remain very objective and transparent about what we do. And we would certainly ask that those staff that are doing that patient education, consent education, are also very objective. At the end of the day, if a patient wants to opt out of the exchange, it is their right to do so, and they can do so at any moment, at any time. And so obviously, if you're getting some questions and you're really stumped and you don't know how to answer it, that's why it's important to send them back to us here at HealthInfoNet. They can call us. There are also ways on our website, if patients have questions and they want to be reached out to, they can obviously do it also via the website. But this staff script is very helpful for new folks or folks that are just having a difficult time maybe answering some questions. They could always have this sort of right next to them as they're doing that patient consent education. But at the end of the day, I just want to stress, certainly feel free to send patients back to us if you have, if they have any question that you feel like you can't answer. But we really try to give you this information to help support you along this process.
Hey, Nicole,
Yeah,
we have our first question.
sure.
So the question is it required that we give these required forms to each patient, or can we have the information posted at the front desk for all patients?
So I certainly encourage both, but patients should be given the opportunity to have the opt-out form. So a discussion should be had, and that's part of what the education is and what the requirement is. Obviously, having any signage is great, but it also needs to be discussed, and you let folks know that you are participating with us. So if they're physically walking through your doors, it's good to have that discussion with them. The patient doesn't need to necessarily take that opt-out form if you offer it to them. You know, there's a lot of folks, I think, as you'll see in the previous slide, I mean, we have about 850 plus connections, I would say a little bit more now. We're onboarding organizations quite rapidly. So that number is certainly definitely increased. We do have a low opt-out rate. So just so folks know, we have about a 1.4 opt-out rate, which is excellent. And I think at this point, because we have so many participants, because we have so many organizations that are already doing this patient consent process, and they will continue to, you know, at each, you know, organization that they go through that is participating with us throughout the state, one time only, that they're getting very familiar with us. And so they may say, nope, all set, you know, I don't need that opt-out form. If they want to take an opt-out form and think about it and get back, you know, to you or to us, they can certainly do that as well. But it's important that that they know that you are participating with us. So that's a great question. On this slide, this is helpful information for implementing patient consent. So as time has gone on, and we've been doing this obviously a while, we've certainly picked up some tips and tricks for folks. And so this is sort of a new form to our communication package. So I do want to highlight that and stress this to folks. Definitely take a peek at this. Whether you're new or currently, you know, established, it's always really nice to be able to have some of this sort of tips and tricks to help folks to clarify any questions that folks have, and really offer sort of those best practices and to avoid any delay in processing any consent forms. So definitely take a peek at that. Speaking of consent forms, so let's hop right in. I'll just take a quick pause. Any other questions, Chad, in the chat before we move on to forms?
Not so far.
Okay, great. So as we talk about, there's 4 different consent forms. The most important, what you will hear me talk about time and time again, the required form is the opt-out. That is the only required form. That's what's given and offered to folks if they so want it. But we also have 3 other consent forms. So we have the opt-out. So those folks that want to not share any of their information. We also have what we refer to as an opt-back-in consent form. So anybody at any point, like I said, can opt out. Anybody at any point can opt back in to the exchange. as well and share their health information. The overarching information here is the general medical information. So I did want to stress that because we do have mental health, sensitive health information data that's also coming in, and there's a separate process for that. But a patient can't choose to opt in their mental health data, but opt out of the general medical information to be shared. So they have to be opting in with the general medical information in order to opt in their mental health information. So that's just really important to note. Sometimes at HealthInfoNet, we will get that. So we'll get folks that will send in a mental health opt-in form, but unfortunately, we're not able to process those forms because that patient has actually opted out of the exchange altogether. So that individual would need to opt in their general medical information in order for us to process any opt-in for mental health information. So just keep that in mind as well. So as I said, the mental health information is a little bit different, and folks do need to opt in for that. So a little bit of a different workflow. And I will stress too, so it is very different from completing a release of authorization that folks are typically completing to get records or get information for their patients. It is, when they opt out, and they fill out the form, that means they want out of the exchange. So they don't actually have to. If they want to remain in the exchange, they want their data to be viewable by their providers, they don't need to do anything at all. So that's just really important to note. So that is different from the mental health. The mental health, they would need to fill out a form and say, yes, I would want all of the users of the health information exchange to view my information, and they would complete that. They could also revoke that too as well. And so that's why there's 4 different forms. Consent roles and responsibilities. So this is also really important. It is HealthInfoNet's responsibility of managing these consent choices and not the organizations themselves. The only requirement for our participants is doing this education. We, within our, within the health information exchange, within the clinical portal, we manage those consent options. And if anybody is logged into the clinical portal, you will see when you go to look up a patient, there is a column for opt out. And if a patient has opted out and there's a date there, you won't actually be able to click on that patient and get any information from them. That's a placeholder, but that's indicating that that patient has opted out. And you can clearly see that. As along those same lines for the mental health data as well, there is a column that would indicate somebody has opted in. So you would be able to see that consent choice. And so that's something, once somebody completes an opt-out form, gets it sent to us, which we'll talk about that in just 1 minute, or they opt in their mental health information, the patient completes the form, it gets sent to us at HealthInfoNet. We process that on our end and we take care of that. So the consent relationship is truly between, the individual, the patient, and us here at HealthInfoNet, and we manage all of that piece. You are just required to say, we now participate with HealthInfoNet, letting them know they have the right to opt out, and that's their choice, and then you're all set. As I said before, too, so there's a couple of things to make note of. The consent choices are also universal. So a patient cannot say, I want Dr. Smith, my PCP to view information, but my specialty provider, I don't want them viewing any information. Or I want my specialty provider to share data in the exchange, but I don't want my PCP to share data within the exchange. The consent choices are universal. So it is sort of an all or nothing. The patient is in the exchange or they're opted out and are not participating in the exchange. Consent choices. So for the general medical information, same thing we've all talked about, talking about the opt-out process. Patients have 3 different ways of doing this opt-out. So they have the printed form, as you've all seen, as is provided in our communications package. Folks can call us and opt out over the phone. And now we have the capability to have it be done online. So I know a lot of organizations, they are moving more towards electronic intakes. They're moving away from paper intakes and paper processes. And so I think it's always sort of been a struggle. Sometimes if you're already, going through this process and you're doing everything electronically, and then to have this online form there, paper form. So now there is the option to walk through this with a patient online. They could do it there with you in an intake, and you can go online to our website and they can complete the form there with you. They can do this at home. They can do it whenever they would like. But I will walk you through at the end of this PowerPoint presentation. I'll show you exactly where you find that information on the website and what a patient would need to do if they wanted to complete one of our forms electronically via the website. As I said, too, patients can, so the reason why there is an opt back in, so you could have a patient who opted out years ago and they've decided that, they're tired of waiting for providers to get their medical records information, and they want to be a part of the exchange now. They can opt back in at any moment. They just complete the opt-in form. What is important to note about that is during a period of time in which a patient has opted out of the exchange, we are not collecting any data on that patient during that time period. So just as soon as we process that opt back in, which we do as soon as we get it, that information will be collected from that moment moving forward. So that's just really important information for not only those folks that might get that question from a patient, but also anybody that's logging into the clinical portal and viewing information on their patients. Sensitive information. So moving back to discuss about the mental health information that's available in the portal. This is only mental health information. There still is no substance use data that's coming into the exchange. That's still being blocked. So it's just the mental health information. And there are actually 3 different ways a user can access this information. You heard me talk about that opt-in form. So a patient can sit with their provider. They could go online to the website now. They could call us. Those are the different options they can to opt in globally for all users to be able to access their information. But the law statute that governs this information also has 2 other requirements for accessing this information for users, which is if a patient is not comfortable completing that opt-in form, but they want a particular provider to view their mental health data, they can provide verbal permission. This is temporary verbal permission. It's only open within a record for 3 days, and then they would need to get verbal permission again from the patient to access it. Or there is an emergency way to access the data as well. So this is something that we go over in training. If anybody has any additional questions about that or they're curious about that, certainly please feel free to reach out to our clinical education team here, and we will walk you through and answer any of those questions that you may have. But those are the 3 different ways. The opting in, making it global, or temporary verbal permission from a patient for a particular provider to access it, or in case of an emergency. Oftentimes we get asked, well, what constitutes an emergency? That is obviously up to the clinician or the provider to that's accessing that information. Typically how we train is, if somebody is at risk of hurting themselves or others, and you feel it is a crisis, it is an emergency, you need to be able to treat this person in this time of crisis, and there may be information that will help you treat them better. If you have access to this mental health information, there is that ability to do so in the clinical portal in an individual patient record. Patient education requirements. So all of the participating organizations that participate with us like I said, drilling it into folks' head, one time only. So this opt-out form, it typically obviously happens sort of at that initial point of contact with a new patient as they're walking through your doors. We do have we talk about in our communications and consent training that obviously for those folks that are new to onboarding and becoming participants with us, that there are two different tracks. You obviously want to be able to reach out to your established patients and make sure they are all informed that you are now participating with us. That tends to be a little bit more of the heavier lift. Takes a little bit of time, takes a little bit of coordination. You want to think about who should be doing that. How do you keep track of that? It's making sure that patients are really not being offered the opt-out form multiple times by multiple people. What we have found here at HealthInfoNet is that gets really confusing for patients and sometimes could inadvertently lead to somebody opting out that didn't want to opt out of the exchange. So that's always really important. Like I said, we will work with you. We provide sort of those tips and tricks. We help walk through that process for you as you're new to us. The really, like I said before, the easier lift is having this for any new patient that's walking through your doors and having this be part of that initial contact that you have with them. If you are seeing that patient face to face, you're providing them with that opt-out form. And if they complete it with you, say they do want to opt out, they complete it there at the office with you, or if you're going into their homes, if you're working in the community and they opt out, they're sitting with you. We do ask that you get this back to us within 2 business days. Fax is the most common way to do that. And that's if you're using the paper form. So like I said, that's just one of now 3 ways to do it. You could always sit with somebody and, like I said, go online and complete the form online as well. But if you're having it on paper and the patient completed it on paper, we just ask that you get that back to us. You will see on the opt-out form all of our contact information, which includes phone number, address, our fax number, and what will also now be included is the actual hyperlink to the electronic form as well. What we really try to do is provide this at no cost to our patients. So it's really important that we offer them the ability to have these different options. Typically, for those new organizations to us, we want to make sure that there is a consent process in place prior to logging into the portal and looking up their patients. So it's really important. And also we provide all of that necessary training and answering of any questions and providing folks with all of the necessary materials that they need as they're just getting started in this process. Communication resources. So this is just going into some of the different posters that we have available for folks. This overview poster, as I said, if you're providing that paper opt-out for folks, making sure that this is included with it. It's really just talking about who we are, what's in records, what are the benefits, talking about privacy and security, and then letting them know if they don't want to have a record within the exchange, what they need to do about that as well. A lot of the same information too is on the opt-out form, but we really just want to try to educate patients and answer any of the questions that they have. So this is the first overview poster. This is the only required poster. We do provide organizations with a couple of other different posters that they can keep in exam rooms, that they can keep in waiting rooms, that they can just have available if they're doing patient education and they need some more visuals or providing more information to their patients. And one of which is this consent choices poster. So it's really walking through what are your choices, whatever choice you choose, what action should you take? And then it will indicate what is the data availability to your providers, given the particular choice that a patient chooses. So it's really, a step process walking you through what you would need to do depending upon what your choice is. Provider poster. So this is just spreading awareness to internal staff about, once again, what is the health information exchange? What is the data that's included? Really highlighting, the benefits about being part of the Health Information Exchange is. And so it's just giving, some different points there to provide to your staff. And then also a patient poster. So letting folks know a lot of the same sort of information, but just from a patient perspective, and letting patients know who we are and what we do, and how ultimately does it help the provider that's working with them. Legal resources and references. So as I said, there's different laws and statutes that govern what we do at HealthInfoNet. So we do, I know this tends to be a little bit of dry information for folks, but there are folks within your organization and your legal teams, your compliance folks, legal counsel, anything like that that may want to review some of this information or just have it on handy. So we do want to make it available to you and accessible to you in an easy fashion. That's why we're providing it. So we have the different references here, walks through some of the two different statutes, which are really the general medical healthcare information. And then, as I said, too, the behavioral health information also has its own statute. Sample notice of privacy practices. So we do include some language with you if you want to take that next step, that next level, and include HealthInfoNet in any of your privacy policies and privacy practices. This is language from the Maine Medical Association that you can use and incorporate. I do know that there are several folks throughout the state that do actually do that. They do provide this information for folks within their privacy practices. So there's also this reference here for any leadership team within your organization to use if you so choose. Training and education. So you've heard me mention this a couple times throughout the webinar today. For those folks that are not aware, and some of you may be, but we have what we call our HealthInfoNet Academy. It's a web-based online program. We have really enhanced over the last couple of years. I think it's a really great resource. It's super effective for those folks that, depending upon their role and staff time, it may not be easy to sit down and do, a webinar-based training, and hopefully maybe sometime soon a face-to-face training. Wouldn't that be nice to get back to that after the last couple of years? Sharon Bearer and myself, who are part of the education team here at HINR, chomping at the bit to get back on the road a little bit. So hopefully here soon being able to do that. But for folks that maybe that's not an option, or, hopping on a Zoom call is not an option, you can send them to the HealthInfoNet Academy and you can have them go through. There's a lot of different resources there. We have our training for the communications package that any person can take. They create an account. It's separate from a user account to log into the portal, so that's just important to know. But you create your own user account within the academy. You can take a course on, like I said, the communications package and consent process. You can take a course on the actual user clinical portal presentation and get a continuing education credit for that, a 1 hour credit for that. But we also have actually drilled down and done some different what we call our different use cases and different areas of focus, such as specialty care, primary care, behavioral health, long-term care. So we've done a lot with those, and created some different webinars around that for folks to be able to log in and view our webinars. We have all of our what used to be our user guides, and now they're a little bit more interactive in wiki version that you can go in, you can type in questions, you can go through some different menu categories to answer any questions that you have. And then we also make the communications package also available for folks on the website as well. But it's really overall sort of hopefully meets different people's needs depending upon, like I said, role and staff time. But like I said, we are obviously always here to help. at HealthInfoNet. This is a picture of Sharon and myself. Please feel free to give us a call, shoot us an email. We do have a general clinical education mailbox too as well. So certainly as questions come up, or you're just not sure how to answer something, if a patient asks you something, or if you're trying to find something yourself, we are certainly here to help you do that at HealthInfoNet. So that also, I will highlight here just our general information as well. We're going to actually pop over to the website. I'll also I know I've been talking a lot, take a quick pause here and see if there were any more questions, Chad, that came in.
No new questions, but it's a good opportunity to remind folks to add them to the chat if you do have any questions, and we can answer them before the end of the call.
Okay, great. So one thing I wanted to show folks is we've also done a lot of work to our website. So this is hinfonet.org. This is our HealthInfoNet website. There's lots of great information. Anything new, recent news, anything that's coming up for us, some really neat statistics that are here on the website. This will also be able to bring you to what we do, providing some information around our services, different case studies. This is where you can also get to the HealthInfoNet Academy. These are our different case studies, as I mentioned before. And then also providing folks with a way if they want to become a participant. We have a new area here where you can complete an online form, and we will follow up with those folks. But for today's purposes, I'm going to click over on the For Patients section of the website. So this is where obviously talking through a lot of the different key points that are mentioned within the communications package, talking about what's in a patient record, what is a patient's choice when it comes to the health information exchange, answering any questions. So there's a lot of different resources here up at the top for folks to scroll through to learn a little bit more about. But if you scroll down to the bottom, this is where the online forms now live. So here are different options that a patient can choose, like I said, on their own, or even sitting with a provider or a staff member at a participating organization. They can come in here and do a couple of things. They can view the online form. So if I click online form here, what you will see is a carbon copy of the opt-out form that is on paper, except it's electronic. So a patient can come through here, click, fill out the form, check the box, click agree and submit, and that will come to us securely and electronically for us to be able to process that for that patient if they want to opt out. If you're looking to download the form as well, you do also have the capability of downloading the form to here as well. One thing I did want to note is that there were some changes to the forms themselves. There is the inclusion of the hyperlink here on the form. But for those folks that are doing a lot of the opt-in for sensitive data or mental health data, there is no longer a witness section that's needed to be completed. Oftentimes, that was something that an organization had to do if they were sitting down with a patient and completing this. They no longer have to. The patient just needs to complete it and send it in. So I just wanted to make note of that. If you notice a little bit of a difference, what we are really stressing to users is these are new forms. We ask that our participants use our forms. We're not going to be accepting any altered forms or any forms that are homemade within an organization. They need to be our forms here at HealthInfoNet. But it is important that organizations have the newest versions of these forms. So know that they live here, know that, when we sent out this webinar invite, we also included where folks can find the communications package as well. So you can print them off there and here online as well.
Nicole, we have 2 questions.
All right, great.
So I'll start with the second one first. It says, if the form is completed online, does anything still need to be sent to HealthInfoNet within 2 business days?
No. So if it's done electronically, there isn't anything else that the organization has to do. It's just offering them, it's even offering different choices. So if they don't want to take the paper form, or if they want to take it so that they have the link to be able to log in on their own. But if they do it electronically, there isn't anything else. It's only if that form is completed on paper and that patient opted out on paper that it would need to get to us within 2 business days. Great question.
Good. And the second question in the chat is related to the data. So it says, I have not been able to get information on mental health even when patients have given consent. I'm wondering how many contracts you have with mental health facilities throughout the state.
Sure, that's a great question. If you log in, when you go to log into the clinical portal, there is a hyperlink that is right below your password. After you add in your password there's a link on the bottom of that says, click here to see data captured in the exchange. If you click that hyperlink, there is a spreadsheet that will populate for you. And if you go down, I want to say, don't quote me, it's probably, I think it's page 4, that the mental health organizations are. It is a small number of mental health based organizations that are sharing data with us. And it's important to note that a patient would need to be seen by a provider that's sharing data with us for there to be information in there that would be viewable. But if you're ever curious, it's really important we update that spreadsheet on a regular basis to head there and take a peek at that to know who's actually sharing that mental health data. Great question.
The third question, Nicole, just came in about noticing that when a patient opts out, there are also sometimes a way to still get information about the patient, perhaps because a difference in their name or maybe an EMS report came in. And if you could provide some insight as to why or how that's happening.
So we do have sort of what we call a master person index, is how we match users up. And so when somebody does opt out, we do use all of that necessary criteria to match up a patient. Certainly if you're seeing that you were able to find an EMS report, so sometimes it takes a little bit of time for us to go back in and match patients with a record that we already have sort of established within the clinical portal. And if it's off by a little bit, it generates a new record. If you're seeing that, please feel free to reach out to our customer care team to let them know that you did notice it, that patient is opted out, but we're constantly trying to work through to make sure that matching is accurate. It's always really important that we have enough accurate information to make sure that we have the right patient. So like I said, please feel free to reach out to our customer care team and let them know. They'll do some investigating on our end to make sure that we can appropriately block that information or combine the record with the opt-out. Great question as well. Any other questions? I know we have about 10 minutes left. Anything else you want to add, Chad? I don't know if there were any links that were dropped into the chat during the presentation.
Yeah, so no other questions from participants in the chat. I did add in links to various materials. So if you have a chance to bookmark those, great. If not, no worries. In the next couple of days, we're going to send the recording of this webinar as well as all of the links and materials. So you'll have those in your inboxes again by the end of this week.
Great. Thanks, Chad. And I certainly encourage all of the folks here on the call, making sure, if there were other folks in your organization or different folks in different departments that may also need this information, please feel free to share it amongst anybody that you feel would be appropriate or need to know person. We're certainly, like I said, trying to get out this to as many folks as possible, but if you want to share it as well, we certainly welcome that. And with that, if there are no more questions, I would love to give you 10 minutes back in your day. I know how busy you all are. I really appreciate you taking the time to go over all of this stuff. It's very exciting stuff here at HealthInfoNet, and we have a lot more exciting stuff to share with you in the future. And so there'll definitely be more communication around that coming up. But I appreciate you joining us today. And obviously, like I said, reach out to us if you have any more questions, and enjoy the rest of your day. Thank you all.